Hey everybody, Dr. Nick Scotto here with River City Physical Therapy, located right here in the heart of Jacksonville. Today I have a special guest with me, a former patient, Brian. He's been gracious enough to come by and tell his story. So we're going to start off with, tell us a little bit about what your problem was, how it started.
A car accident when I was 11, and then just skateboarding and everything else growing up. But my neck, this was like, my shoulder went to the dashboard, and it was never the same. So, it would like crink up, and sometimes this shoulder's a lot higher than the other.
I got you.
It would stay that way for a couple of weeks or whatever.
So it's kind of like a reoccurring thing.
It would flare up, and then there was nothing. I mean, I went to chiropractors and tried different things, but it was painful.
Okay. And then, so kind of describe what you felt. Was it like a burning, a tightness? What would you?
It definitely tight. I had trying to move my neck that way. It was very hard. It was almost like I didn't want to move, because everywhere you move, there was just like pain. So that was. And then you're just trying to function at the same time and trying to stretch it out a little bit.
And we talked about that stretching a little bit.
Yeah.
So, and I think I remember you said you had some numbness and tingling down the arm at some times?
Yeah.
Or?
There was, it would go all the way down, like my thumb would be numb or, whatever. And even I remember in college, this is 15 years later, I remember I was waiting tables, and then my wrist would just give out. And I'm like, what is going on? It wasn't like I was in bad shape or anything like that. It didn't make sense.
Right.
But yeah, I'm pretty sure it was all connected.
Right. And you bring up a good point, because oftentimes people have symptoms in like this area or in their elbow or in their hand. In reality, it's coming from the neck, which is what we ended up treating to resolve your issue. So tell me a little bit about the difference between the care you have with working with me as opposed to like the difference in treatment and how it affected you.
Sure. I went, when I was 11, 12, I went to a chiropractor right after, he's just cracking us up. And I don't know if that really did anything, but then I've been to at least three other chiropractors along the way, and it never gave me relief, and then a massage therapist, I went that helped one time. Like I could say, wow, okay, this is different, this is different, but it still was not. It didn't do it. I don't know, Nick. It's like you just fixed me, and I don't know. There's one time you gave me like 3 exercises, and I just do one. I do one every morning in the shower, and I'm good. It's crazy.
All right. That's good. That's good.
He's the bomb. He really is. Like, I'm serious. Like this morning, I was like, "Yep, I'm doing my exercise." And go ahead. Well, I don't know. It's just like one thing I notice is that if things are intense or there's a lot of work going on, or times that you can stress out, I can feel like I got to make sure I do my exercise because there's just that little extra tension in there. So, but I tell you,
so the work you do, tell us a little bit about that. Your setup and your workplace and all that.
Right. So I'm on computers all day long. We have editing suites of audio and video, and so I'm always doing this kind of stuff. And so, I've heard you say a couple things like just make sure you stretch and do the opposite of all that. So I try to do that, but I'm sometimes I'm good at it. But
you try your best.
Right. But I have a stand-up desk, which kind of helps me just move more. And then sometimes I'll just find a wall and do that exercise.
Do the good exercise.
And it's almost more like preventative, because I'm not feeling. My neck. I haven't had this thing flare up ever since. It's been 2 years now.
But about a year to 2 years since I was last seen you. Yeah.
So
2 years you've been doing good.
Fine.
That's good.
So,
and I always tell people, that's part of like getting to the root cause of the problem. If you get to the root cause of the problem, the issue shouldn't really come back. But if you address symptoms, like just kind of like the tightness here or whatnot, it'll feel better, but it'll still kind of come back, like you mentioned.
Right.
So that's good. So how would you say, your work and just kind of day-to-day life's different as opposed to working on the computer, and you haven't had the wrist buckle coffee mug, have you?
Right.
How would you say that your life is now compared to before when you were having that pain issue as far as the burning and stuff?
I mean, in one sense, it's night and day. Like, and because it's not like my neck was always walking around like Igor or something like that. But like, it was definitely, I knew I was going to have to deal with this a few times, and then, and stretching out is going to be a problem, and so just knowing what to do, like to prevent that from happening, and then just being vigilant on that. It's just kind of a reassuring.
Yeah, I mean, you bring up the key point. You having the knowledge to know what to do, so you don't have to keep coming back, reoccurring visits, and then so you can essentially take care of yourself. Yeah. I'm trying to remember. I think you came once or twice. How many times did it take us to kind of figure out what's going on and get you the relief? I think
maybe twice.
Maybe twice. Okay.
Because I don't know. I kind of think it was just one.
It may have been once, where we're going.
You gave me, well, I'll tell you. So you did a bunch of things. You're like, and then you gave me 4 exercises.
Okay.
And I started to do, and I did them, but there was 2 that I just were kind of like, I'm going to do these 2, And then now I just do 1. But it doesn't. Like, I don't know. So I don't know what to say. I'm going to get in trouble.
No, that's all right. Sometimes it just takes one. Sometimes it just takes one. Usually it takes 3 or 4 to get things going, and then for long term, maybe you just do that one as preventative, like you said, and that's the key. Right. Continue to do them so the issue doesn't come back.
Right. So that was, okay, this is probably important because like in the beginning, it's not like it went away like 30 minutes later. No, but within, I started noticing a difference in that first week. And then the second week, and it happened. And of course, I came to you, I think, or during that time, I was like
during one of your flare-ups.
Right. Yeah. It was like, I'm not feeling good. So, so that it helped subside it, and then it just went away, and it never came back.
So part of the struggle people have is they deal with pain for so long. You had it for about 30 years or so, just kind of reoccurring flare-ups here and there, hit and miss. Right. Nothing really worked. You're kind of like, well, shoot, I've been here, I've been there. It hasn't really worked. Kind of, what would you tell people that have that kind of thought process? Because I've dealt with pain too for a long time, and I know what it is to feel like well, nothing's going to work, But what would you say, like, to someone who struggles with those thoughts or who doesn't think like, oh, will this really help me?
Right. I mean, you have to give it a try. It's kind of like, why not? So it's almost, you can decide, well, I can either do this little thing that's going to have this great effect on the rest of my life, or I can just not change anything. And if you don't change anything, then nothing changes. Like you're going to wake up tomorrow and you're going to have the same issue. So it's like investing. Not that I have a huge portfolio, but I do know that there's this curve, and if you get in and you all of a sudden, there's this dramatic increase that happens. So
that's right.
Yeah,
that's right.
So just do it. Just go. I mean, how many times have you been to a chiropractor or whatever? Try something different. So.
All right, Brian. Well, I appreciate you coming by today, and I'm glad that still a year or 2 years later, you're still pain-free. And I'm sure you'll continue to do well because you're dealing with your exercises. Yeah. All right. So if you've been dealing with any issues for quite some time, haven't really got the relief you wanted, I would invite you to just give us a call at 904-566-7070, and we'll talk about your symptoms and your pain and what's going on, and see if we can figure out a plan for you to end it.